To kick us off, I'd like to welcome Tom Coderre. Tom is a Rhode Island treasure. With decades of public, private, and nonprofit service, Tom is the first person in recovery to lead SAMHSA. His career has been significantly influenced by his personal journey and philosophy, and we'll hear more about many of the things he's brought to the office at SAMHSA. He's well known in the addiction recovery community and joined SAMHSA as a senior advisor to the administrator in August of 2014. He's now the acting assistant secretary for mental health and substance use at SAMHSA after being appointed by President Biden to lead the agency in the interim earlier this year. From 2016 to 2019, he served as a senior advisor to the Rhode Island governor, Gina Raimondo, in which capacity he was the liaison to the General Assembly and coordinated our state's response to the opioid crisis. That's where I spent a lot of time with Tom and Jody, who leads, Jody Rich, who leads the COBRE on opioids and overdose, and I co-wrote the strategic plan and worked very closely with Tom in implementing it. He's the former chief of staff to the Senate president in Rhode Island, former national director, field director of the Faces and Voices of Recovery, and former board chair of Rhode Island's own statewide recovery community organization, RICARES. Tom's also served as a member of the Rhode Island Senate from 1995 to 2003, and he's a graduate of Rhode Island College. He works on a variety of issues at SAMHSA, and you'll be hearing about some amazing initiatives where he's taking the lead. Please welcome Tom Coderre as our keynote today.
Good morning, Tracy, and thanks so much for that kind introduction. We're going right into the keynote right now.
I think, let's see, small transition maybe as you grab your slides, but and
yeah,
grab a cup of coffee if you'd like, or water for those who are joining.
Wonderful. So it's a real honor and a privilege for me to be able to join you, Tracy, and your colleagues with the COBRE and all the organizations that are partnering on today's event. It's so great to see everyone coming together, in such an impactful way to solve one of our most pressing issues in this country, and that's of overdose, right? The overdose crisis that we're in the middle of. And I'm going to talk a little bit about the federal efforts and where we're leaning in to try to be part of the solution. But before I do, I'd love to just share a short story with you, if that's okay. This story is about a man who, by the time he was 30 years old, was pretty successful by most people's standards. He came from a good, loving family, and he had many friends. He was employed in nonprofit management and development for many years, and he had risen in his career to become the executive director of a large nonprofit agency. He was also very involved in his community, and he had a love of politics, and he got elected to the state Senate when he was 25 years old. So on the outside, as you can see, everything about this man's life looked normal, and some would even say perfect. However, on the inside, he was tortured. So he turned first to alcohol and then to other drugs to cope with the stresses that he was experiencing. Underestimating the power of these substances and not understanding the neurological consequences of taking them, he quickly became addicted, and his life, well, you know what happened to his life. It started this downward spiral. As his life began to unravel, he started to lose the things that were most important to him. When his family and friends tried to help, he resisted their help and he pushed them away. This caused him to lose them. He lost interest in politics. He lost his job and his position in the Senate. His health deteriorated. In the end, he lost everything, even his desire to live. This man's life, which at one time was so full of hope, became hopeless pretty quickly. And as some of you may have guessed, I know this story well because it's my own. But fortunately, the story does not end there. I was able to get the help that I needed. And today, I'm a person in long-term recovery, which for me means I haven't used alcohol or other drugs since May 15th of 2003. So over this 18 years, I have had this incredible opportunity to heal, to experience, and to rebuild my life. And my life has gotten a whole lot better over that time. In fact, being in recovery hasn't just enabled me to create a better life for myself, but it's also enabled me to create a better life for my family and ultimately for my entire community. Because that's what happens when we help people find and sustain their recovery. Everything around them changes. And we know that recovery is much more than just not using alcohol and other drugs. It's about creating a better life. It's that process of change, right, that we talk about, that people go through. You know, one of the things that I am incredibly grateful for is the fact that I had access to psychiatric services and long-term intensive substance use disorder treatment. That should be available to anyone who needs it. You know, I was lucky to have spent 6 months in a long-term residential facility. And then for me, the transition from treatment to sustained recovery was marked by my acceptance into a recovery house where my journey continued. You know, I am forever grateful for that option and that opportunity that I had, that privilege that I had. For my recovery home played an irreplaceable role in my personal story of recovery. We know that a person with safe, knowledgeable, supportive, and accepting home environments, they're better poised to secure stable employment, to pursue education and job training, to maintain recovery, and ultimately be able to give back and build up a reserve of recovery capital that contributes to the well-being of every member of their community. You know, SAMHSA calls this health, home, purpose, and community, the 4 major dimensions that support a life in recovery. Make no mistake about it, I was a badly broken human being just 18 years ago. And my road through treatment to recovery, it's been long and it's been winding. And even with the services that I was fortunate to receive, you know, no one waved some magic wand and I instantly became well. It happened over time, not overnight. And it happened because I had support. I know that you understand, many of you on this call, you work in the trenches every day, and you understand the hard work that's required to complete treatment and to sustain recovery. And you also know the vital role that peer support plays in that process. You know, there are many pathways to recovery: 12 steps, mutual support, medication assisted, faith-based, fitness-oriented, smart recovery, natural recovery. You know, some people just wake up one day and decided they've had enough. And it's not really important how somebody gets into recovery. It's more important that they do. Their pathway is not as important either. It's that they don't path alone, that they have help and they have somebody to walk on that journey with them. So for me personally, peer support was essential for my recovery. Peer support taught me that I was not alone. Peer support taught me that treatment is effective and that people can and do recover. It provided me that hope, community, a belief in today, and a faith in tomorrow. Peer support also provided this resilient and robust infrastructure of people and places, and peer support provided this loving but rigorous cohort of reinforcers. You know, the people who understood the pitfalls, the daily struggles, the doubts, the uncertainties, the rationalizations, and who, passing no judgment, they didn't waver in pointing the way forward for me. These peers are people that a power much greater than myself brought into my life to give meaning and purpose to my life and to set me on a path where I too would be able to have the chance to help others in need. You know, after living as a resident in that recovery house for 6 months, I eventually became the assistant house manager and then the house manager. And for almost 3 years, I called it my home. While living there, I went back to school and I finished my bachelor's degree. I was 9 credits short of a bachelor's degree. I had this habit in my active addiction of starting things and not finishing them. I also was able to obtain employment outside of the recovery house, employment that bolstered my confidence and encouraged me to take the next steps on my journey. During this early phase of my recovery, I established a recovery regimen that sustains me to this day. I continued seeing a medical doctor and participating in outpatient counseling and therapy. I started taking care of myself physically as well as mentally. I attended 12-step fellowship meetings, and I started to socialize with other people in recovery. So today, through treatment, recovery, and hard work, I am once again an active and productive member of my community. And I've been able to regain the things that in my life that are the most important to me. When rebuilding my career eventually became a priority, I'm forever grateful to the folks at the ATTC at Brown University who looked beyond my health history and gave me the opportunity to restart my professional career. My friend Steve Gumbley and Sue Storty, who asked me to help them do training coordination at the ATTC. Imagine the disbelief in my eyes when I received an employee ID from an Ivy League institution that said faculty and staff on it. When I had 3.5 years in recovery, I went to work at Faces and Voices of Recovery in Washington as their national field director, as Tracy mentioned. In that position, I traveled around the country for 2 years, about 245 days each year, working with recovery community organizations to help build a constituency of consequence that would stand up and speak out. Then I was able to go back to the state Senate in Rhode Island, where I once served, and become the chief of staff to the Senate president, a job I held for 6 legislative sessions. You can imagine what a personal milestone that was for me. This is really where I first saw my life come full circle in recovery. And in 2014, I was appointed by President Obama as a senior advisor to the administrator at SAMHSA. And working at SAMHSA gave me the opportunity to participate more directly in the federal administration to advance publicly supported prevention, treatment, and recovery programs. After that, I returned to the Rhode Island State House, but this time as a senior advisor to the governor. And as Tracy mentioned, I got to help coordinate the state's response to the opioid crisis and to work on mental health and addiction issues more broadly. In 2019, I returned to SAMHSA as the regional administrator for Region 1 in New England. And then on January 20th of this year, the Biden-Harris administration asked me to be the acting assistant secretary. And then Dr. Delphin Rittman was appointed, and I slid over into the acting deputy assistant secretary role, where I'm helping her transition into her new job, and I'll remain there as long as I'm needed. So in all of this, I've been very, very fortunate in my professional life to have worked both in the public and private spheres, to count as colleagues and friends, grassroots organizers, frontline workers, and public policymakers, and to be able to see the world through their eyes, to gain the benefit of their perspective, their expertise, and their lived experience. And that's really guided me. So you can see peer support continues to carry me through the day. Whenever I have a crisis of confidence, and that happens frequently when I don't know how to do something or what the answer might be, I can reach out to friends like Tracy or Jody or others on this call, and we can brainstorm solutions. Throughout my journey, I've also been very fortunate to have incredible support from my family. That family that I say I resisted their help and pushed them away, they're back in my life and I'm back in their life. I have 6 nieces and nephews, my brother and my sister, my parents. I lost my dad 2 years ago, but he got to see his son in recovery for 16 years, and that was an amazing gift. Today I have stability, I feel great, and I'm active in the things I love: family, friends, community, service, policy, politics. And I have relationships with people that are so much deeper, stronger, and meaningful than anything I had prior to finding recovery. So these are also the gifts. And I want to acknowledge that my story of recovery, my story of rebirth, redemption, or whatever you want to refer to it as, is not unique. It's important and it's special to me, but it's not unique. It's the story of more than 25 million Americans. It's my story, and maybe it's some of yours on this call today. And while we've made progress, the hard truth is that there's just as many people that are struggling as we gather here this morning. And I am constantly in pursuit to help them find what I've found. And I know you all are too. So it's an honor being here this morning. It's an honor to be able to share my story with you. And now I have a few slides that I want to share with you where I can just talk a little bit about the federal response to the crisis that we're in the middle of. But thank you for bearing with me and allowing me to share some of my personal experiences first. Let me see, I'll go to my slides here. Great, so hopefully folks can see these all right, and I will start to show the slideshow in the beginning. I would assume somebody would tell me if they can't see these, so I will just assume they're showing up fine for you guys. So at SAMHSA, we're good. Thank you, Tracy. We are concerned with behavioral health, which of course is a national priority. And our mission is to reduce the impact of substance use and mental illness on America's community. Many of you know us for our grant making, and clearly I'm going to talk about our grant making today, and that's super important. But we also are concerned with leadership, providing leadership to the field, voice, data, surveillance, public education, regulation and standard setting, and practice improvement. We believe that behavioral health is essential to health. You can't have one without the other. Prevention works, intervention is important, treatment is effective, and people can and do recover. I mentioned Dr. Delphin Rittman, who is our new Assistant Secretary for Mental Health and Substance Use. She has outlined 5 immediate priorities: preventing overdose, enhancing access to suicide prevention and crisis care, promoting children and youth behavioral health, integrating, and we've heard this for a long time, but we're really trying to do something about this, integrating primary and behavioral health care, using performance measures, data, and evaluation. Those are her 5 near-term priorities. And she's also identified 4 cross-cutting principles that underpin all of those priorities: equity, workforce, financing, and recovery. So this is kind of what we're focused on, and this is our roadmap. And it aligns with the new administration, the Biden-Harris administration's priorities. And we are trying to make sure that we are integrated as much as possible with those new priorities. Many of you know that HHS Secretary Javier Becerra just announced and unveiled HHS's overdose prevention strategy. And I wanted to take a few minutes to talk about it here this morning. It's no surprise to anybody on the call that the overdose crisis is really worsening, and it's largely driven by synthetic opioids, predominantly illicitly manufactured fentanyl. Drug overdoses involving psychostimulants such as methamphetamine are also increasing, both with and without synthetic opioid involvement. The provisional trends, this is data on this slide from 2019, because that's the last official data we have from CDC. We should be seeing the 2020 data soon, but the provisional data suggests that overdoses are increasing for psychostimulants and cocaine. For the period ending December 2020, we know that we have more than 93,000 predicted overdoses, increases in all but 2 jurisdictions. The only jurisdictions that didn't see increases were New Hampshire and South Dakota. All opioids saw a 37% increase. Synthetics saw a 54% increase. Psychostimulants saw a 46% increase. Cocaine saw a 21% increase. And the trends were worsening during COVID, despite our best efforts, despite introducing flexibilities, increasing the amount of medications, treatment, and other types of supports available to people. So that's the reason why we're here talking this morning. That's the reason why Secretary Becerra released this new strategy. And I just wanted to share a few highlights of the strategy with you. Given the changing face of the crisis and the escalating harms, including during the COVID-19 pandemic, Secretary Becerra released this new strategy. It's comprehensive, it's resourced, and it's really to strengthen our primary prevention efforts and increase access to the full continuum of care and services for individuals with substance use disorders and their families. The strategy reflects the Biden-Harris administration principles of equity for all underserved populations and evidence-based policy by being more inclusive of all populations affected. And we're, also these priorities are translating research into equitable practice. And we're trying to identify ways to further our understanding of how to mitigate overdose harms. The strategy recognizes that addressing the overdose crisis requires a multifaceted and integrated approach spanning public health, healthcare, human services, and many, many other sectors. So we're moving away from talking about this as an opioid crisis and talking more about really identifying the root causes of overdose, because as we know, it's moved way, way beyond opioids at this point. Experts across HHS came together to leverage the best evidence to prioritize 4 key target areas for the strategy: primary prevention, harm reduction, evidence-based treatment, and recovery support. Within each of the priority areas, the strategy lays out 4 objectives with associated activities. There's 44 activities in total. So these high impact featured activities are not exhaustive of all the HHS activities in this space or that are underway to address overdose, but they are a good sampling of those. Additional activities are going to be added over time, and outcomes associated with each activity are going to be measured regularly to assess the progress, and so we can make changes as we see necessary. There are 4 cross-cutting principles that are guiding this entire strategy. Equity, maximizing health equity for underserved populations is definitely one of our strategy focuses. Activities aim to provide culturally competent care and address underlying social determinants of health. The strategy objectives and activities are informed by the best available evidence and data is going to be used to measure, monitor, and track the patterns and trends. Public health surveillance, data, research, and evaluation are going to be critical components to each of the priority areas. The strategy aims to break down barriers that silo substance use disorder services from other types of healthcare and social services, and to promote integrated care. And healthcare systems, social and self-stigma really impede access to substance use disorder services. We all know that. The strategy activities aim to reduce false perceptions about SUD and people who use drugs for that matter. Let's look at each of the priority areas in a little bit more focus. Preventing substance use and substance use disorders is critical to reducing overdose deaths. This priority area supports population level and individual level multidisciplinary substance use disorder prevention activities that are necessary to address the biological, behavioral, social, and environmental risk and protective factors. We have 4 objectives, as you can see here, to support research and surveillance, to develop and improve delivery of prevention interventions, facilitate the implementation of evidence-based primary prevention across the lifespan, support the development of and promote evidence-based treatments to effectively manage pain, and reduce clinically inappropriate prescribing of medications with the potential for misuse. And then you'll see that there are some examples of some of the activities that are tied to each of the different priority areas and objectives in each of those priority areas. So you'll see CDC is working on surveillance and SAMHSA on our strategic prevention framework. CDC is working on updates to the guideline for prescribing opioids, and the FDA is working on safe use of benzodiazepines. In priority area 2, harm reduction, we know that evidence-based and promising harm reduction strategies reduce the risks that are associated with drug use, including overdose and infectious disease transmission. Examples of harm reduction include fentanyl test strips, syringe service programs, and naloxone. Harm reduction also connects people to important health and recovery support services, and supports an environment that challenges community stigma toward people who use drugs. I don't know about you guys, but I've been working in government for a long time, and it's really satisfying to finally see a strategy that calls out harm reduction specifically. We've got 4 objectives in this priority area: advance research and demonstrations on innovative harm reduction approaches, promote evidence-based harm reduction services, including those that are integrated with healthcare delivery, expand sustainable funding strategies for harm reduction services, and finally develop educational materials and programs to reduce stigma. And you'll see some of the examples of activities. NIH and FDA are working on improving fentanyl test strips. CDC and SAMHSA have come together to jointly work on what was CDC's Harm Reduction Technical Assistance Center, and to expand that, actually double it in size, so that it can work with more community-based organizations that are delivering harm reduction services. And part of that is in preparation for the next priority example of an activity, the harm reduction grants. The American Rescue Plan included $30 million for community-based harm reduction grants that we'll be putting forward, so that can work hand in hand with the Harm Reduction Technical Assistance Center. And then CDC has a new Stop Overdose campaign that they are working on. Priority 3 area is around evidence-based treatments for individuals with substance use disorder. It's essential to reduce health and social consequences of substance use. This priority area aims to reduce barriers to accessing effective treatments, advance strategies to support and improve engagement and retention, and to continue to develop new therapeutic approaches. Some of the objectives are to support research on and development of new treatments and strategies to improve engagement and retention in care, broaden access to evidence-based care that it increases willingness to engage in treatment, increase the uptake of evidence-based treatment delivery that improves engagement and retention in care, and promote evidence-based integrated care for people with co-occurring conditions across lines of service and care settings. And you'll see some of the examples of activities like the Healing Communities initiative that NIH and SAMHSA are working on. CMS has its Medicaid section 1115 SUD demos. CMS is also working on a maternal opioid misuse model. Some of you may have been part of that work over the past couple of years. And CDC has its overdose response strategy. And last but not least priority area, and my favorite priority area, of course, which will come as no surprise to you guys, is recovery support. For many individuals with substance use disorder, we know that treatment alone is insufficient to support long-term recovery. In fact, it's only the start of the engagement process. Recovery support services, as I shared with you in my own personal story, can enhance an individual's outcomes by supplementing treatment and bolstering recovery capital. Examples include supportive housing, recovery workplaces, and peer support services. Some of the objectives include enabling access to and encouraging use of integrated recovery support services, improving the quality of and coordinated recovery support services, strengthening recovery support workforce. We know we need to continue to work on that, and research, to do more research and identify best practices for recovery support services and strategies that are going to sustain those services. And some of the examples we have identified here of activities are our recovery support service grants that SAMHSA has. We have a brand new, well, it's probably a year and a half old now, a peer recovery center of excellence that's helping really build more effective recovery community organizations that can deliver services. HRSA has its paraprofessional education and training program, and CDC has a workplace supported recovery initiative. So how are we going to resource all of this? Well, the President's fiscal year 2022 proposed budget for HHS on overdose prevention programs and initiatives totals $11.2 billion across the department. There's $3.9 billion more in FY21, a 54% increase from FY21 enacted. It includes funding to expand access to substance use prevention, treatment, harm reduction, and recovery support services, as well as funding to bolster the nation's behavioral health infrastructure. I'm going to talk a little bit more about SAMHSA's budget in a minute, but there's $3.5 billion more for the substance abuse prevention and treatment block grant, the set aside for recovery support services, and then HRSA's request includes $1.1 billion in mandatory and discretionary funding to support the substance use disorder response in community health centers, invest in our National Health Service Corps, develop behavioral health workforce, and expand substance use disorder response in rural America. So that is the kind of the top line messaging around the HHS overdose prevention strategy. Where can you find out more information? Well, you can go to the website, of course, HHS.GOV /overdose-prevention. That will give you all of the initiatives. This is where we're going to track all this information that I mentioned. We're going to, be constantly updating this website, but you can see the 4 pillars. You can dive down into each of the pillars and see more about the specific activities. I only mentioned a few, one example per objective here, but you can see all the 44 activities on the website. Again, we'll continue to update this as we go along. So we are going to be monitoring and updating the plan as necessary. We're identifying opportunities for interdepartmental partnerships. This strategy cannot succeed if it's only HHS alone. We need to bring in our sister agencies, DOJ, DOD, the VA, Department of Education, and more. And the overdose prevention strategy will guide future policy development at our agency and across the government. Now let's talk a little bit about SAMHSA's budget. Our regular appropriation at SAMHSA prior to COVID was, you'll see it at the bottom there, $6 billion in 2021. And then because of a variety of COVID relief bills, like the one that's on this slide, we received an increase of $4.25 billion to that budget. And these are the different areas that it went into. $1.65 billion increases in each of the block grants, the Community Mental Health Services block grant, the Substance Abuse Prevention Treatment block grant, gave immediate resources to states and local communities to respond to the crisis at hand. Then in a few months later, the American Rescue Plan passed, which gave an additional $3.56 billion to SAMHSA, another $1.5 billion for each of the block grants, and then additional resources for community-based funding for local substance use disorders. That's the harm reduction grants that I mentioned earlier, and a bunch of other important programs as well. And then in 2022, our budget request is $9.7 billion. So you'll see where some of those increases lie in our FY22 budget request. That is still making its way through Congress, and we are hoping that it gets looked upon favorably by them. We know that this budget process is a complicated one, but we're really pleased to see, that we are getting the resources, finally, additional resources that we need to respond appropriately to the communities that are struggling around the country. These are a list of some of our grants and resources. You can see we have many different grant programs that are really responsible for helping us combat the crisis, and lots of publications and resources that we are constantly publishing, updating, putting out there into the world for all of you to use. We also have, I mentioned the ATTC earlier, and about my story about going to work there. The ATTCs are kind of our flagship training and technical assistance center. We have 20 some other technical assistance centers as well, who are helping us get this information out into the community, helping to train our workforce and really bring people together to learn and try to do things better. I wanted to just touch on a few of SAMHSA specific programs and give you a little bit more information since we have a little bit of time here. Our state opioid response program, the aim of this program is to address the opioid crisis by increasing access to medication-assisted treatment using the FDA-approved medications. It's turned out into a really big program, almost $1.5 billion today that's available for dealing with the opioid response that's happening in 57 jurisdictions around the country. In addition, the SOR grants now have been expanded to be able to address stimulant misuse and disorders, including cocaine and methamphetamine, which we talked about earlier, has been spiking. There's a sister grant to the SOR grant called the TOR grant. That's the Tribal Opioid Response Grant, which is doing the same kind of work, but in Native American communities around our country. We have our first responders Comprehensive Addiction Recovery Act grants, which is to allow first responders and members of other key community sectors to administer a drug or device approved or cleared under the Federal Food and Drug Cosmetic Act for emergency reversal. So we're talking about Narcan here. This is the congressional language for it. In SAMHSA's work, first responders are including firefighters, law enforcement officers, paramedics, emergency medical technicians, who are getting involved and really helping. Here's a little success story about DuPage County Health Department in Illinois, which is sharing information that the grantee developed a GIS map to show naloxone administration by municipality, substance use treatment providers, drug take-back boxes, and overdose reversals and cause of death from the coroner's office. Philadelphia implemented a new EMS alternative response unit known as the AR2. A paramedic and a case manager ride together in AR2, which is a marked fire department SUV, and they respond when an individual is revived from an opioid overdose. I don't know if anybody was listening to NPR this morning, but there was an NPR story about San Francisco who has a very similar model and are having a lot of success out there with that. Our harm reduction grant programs, I wanted to just mention briefly here. You're going to be seeing this funding opportunity announcement soon. This is to encourage individuals to take the steps to reduce the negative personal and public health impacts of substance use, reduce access barriers for underserved populations, reduce stigma, and increase inclusivity. The purpose is to connect individuals to overdose education, counseling, and referral to treatment for infectious diseases, support distribution of opioid overdose reversal medications, and more. Lots of equipment and supplies can be purchased with these grant dollars. We have our medication-assisted treatment, our MAT-PADOA program, which many of you are aware of, and it's been around for a long time, which aims to expand and enhance access to medication-assisted treatment services. Rutgers University initiated a peer navigators specialist program. As a result of the program, there was a marked instantaneous uptake of dosing and prescribing of buprenorphine by 22%. And Rushford implemented a tricycle, which is an app to connect client, clinician, doctor, and recovery specialists together. Since the inception of the app, over 7,000 interventions have been made, and the program reports there's been no overdose deaths or suicide attempts. And then we have two of our flagship peer recovery support service programs, our RCSP grant program, which has been around for a long time, and our Building Communities of Recovery program. Many of you know about our practice guidelines, which allow any doctor or other practitioner to administer buprenorphine, by exempting them from some of the requirements like education and providing counseling to clients to try to increase the number of docs that are prescribing. Since this was released back in April, we have had 6,300 practitioners take advantage of the exemption. So in theory, we have 6,300 more people prescribing this life-saving medication today than we did back in April. I know many of you are concerned about the COVID flexibilities. There's an urgent need to continue to address the needs of those with opioid use disorder. We're working very closely with the DEA to make sure that people with opioid use disorder continue to get the treatment that they need. We've made it flexible so people can get a greater number of take-home medications, medication pickup and delivery flexibilities around prescribing and dispensing, telehealth flexibilities, and expansion of mid-level practitioner clinical responsibilities. We are working very closely to try to review the data and the evidence about continuing these flexibilities into the future. So stay tuned for more information about that soon. There was a moratorium that has been lifted on mobile methadone units. That moratorium existed for many years, and now it's been lifted, and you can use your SAMHSA grant dollars to get these mobile methadone units up and running again. And then we're looking at contingency management. How can we raise limits and make this evidence-based intervention, especially for stimulant use disorder, more available to people around the country? And those are my slides for today. And I want to thank you again for the opportunity to be able to be with you and to present. And I would love to use the rest of my time to answer any questions folks may have.